We hear about HIV and AIDS a lot in the media, whether it be through charities or various disease prevention campaigns. But do you actually know what HIV and AIDS is? HIV, or the human immunodeficiency virus, is a virus that affects the immune system, and more specifically T helper cells, or the CD4 cells. This is a type of white blood cell. Helper T cells get their name because they stimulate and activate other types of white blood cells to help fight off infections from foreign bacteria and viruses. When HIV is introduced to the body, it begins attacking the helper T cells, and it uses these cells to make copies of itself. Viruses are unlike bacteria, and they cannot reproduce on their own. They require a host to copy and pass on their genetic information. They're also not treatable with antibiotics. And since the V in HIV stands for virus, antibiotics don't work against them. So that form of treatment is ineffective. We currently have 6 treatments for HIV. I say treatments because they're not a cure. There currently is no cure for HIV. The first 2 treatments are as follows: non-nucleoside reverse transcriptase inhibitors, or NNRTIs, and nucleoside reverse transcriptase inhibitors, NRTIs. They essentially work the same way, and this is how they work. HIV will latch onto the helper T cell and then inject its RNA. While the RNA is inside the T cell, it will now be converted to DNA using a process called reverse transcriptase. These drugs prevent HIV from transcribing its viral RNA into DNA. Therefore, no replication is possible. And as I said earlier, the nucleoside reverse transcriptase inhibitors essentially work the same way. The third drug that treats HIV is protease inhibitor, or PI. Protease is an important HIV enzyme that allows HIV to mature. These drugs block protease. It prevents HIV from becoming mature. The fourth type of drugs are fusion inhibitors. These drugs prevent HIV from latching onto the helper T cell, or the CD4 cell. If they can't latch onto them, then they can't infect them. The fifth type of drugs are CCR5 antagonists. These block HIV from entering the CD4 cell. The last drug type are integrase strand transfer inhibitors, or INSTI. These prevent the HIV DNA from inserting itself into the CD4 DNA. This would be the step immediately prior to the replication of more viruses. So this is sort of the last defense. As you can see, there are various drugs that interfere with the replication process of HIV, whether it be before it enters the CD4 cell or while it's already infected it. Although all these treatments exist, the best form of treatment will always be prevention. HIV is transmitted through various body fluids, more specifically blood, semen, and vaginal secretions. It can, however, be transmitted through sexual intercourse of all types, and it has been noted to be seen in saliva and tears. Used needles and breast milk can also be a means of transmission, so practice safe sex and avoid sharing dirty needles. There are 3 stages of HIV. The acute stage, which results in terrible flu-like symptoms, swollen glands, fever, aches and pains, and sore throat. And this is a period where a large amount of the virus is being produced, and your CD4 cells can drop rapidly. The second stage is a clinical stage. Usually no symptoms or very few are present. The virus is produced at very low levels, and if the person is being treated with medication, they can survive in this stage for decades. Without treatment, however, people usually remain in this stage for about 10 years. AIDS, or the acquired immune deficiency syndrome, is the third and final stage of this disease. At this point, the immune system is so badly damaged that a person is extremely vulnerable to infections. Someone has AIDS when their CD4 count drops below 200 cells per cubic millimeter, and a person with a healthy immune system has anywhere between 400 and 1600 cells per cubic millimeter. At this point, a person usually survives about 3 years unless an infection occurs. There is a silver lining, however. Thanks to medical advancements, the drugs that we discussed earlier were invented, and because of that, people usually don't progress to AIDS. They remain in stage 2 for the rest of their life, as long as they're taking their medication regularly and the medication is available to them. Thank you so much for watching this video. I hope you enjoyed it. If you did, please like and subscribe, and check out one of our other videos.